Have you ever encountered someone who always wants to be the center of attention, but struggles to show empathy? They might be showing signs of narcissistic personality disorder. Narcissism is not considered a typical medical disorder. Instead, it refers to a personality disorder, known as Narcissistic Personality Disorder (NPD). NPD is a psychological condition in which a person has an inflated sense of self-importance, requires excessive admiration from others, and tends to lack empathy for others. The key characteristics of this disorder include feeling superior and more important than others, constantly seeking praise and recognition, difficulty accepting criticism or failure, tendency to exploit others for personal gain, lack of empathy toward others, mild narcissism or more common traits e.g. taking pride in achievements, don't necessarily indicate a personality disorder, and may be considered normal human traits. However, if these traits are severe enough to impact relationships or daily life, they may point to narcissistic personality disorder, which might require therapy or psychological support. Narcissistic personality disorder, NPD, can cause difficulties in interpersonal relationships, work and social life. People with NPD often display behaviors that are hard for others to tolerate because they believe they deserve special treatment and may disregard the feelings of others. Additional symptoms that can appear in individuals with NPD include blaming others. They often avoid responsibility for their mistakes or failures and tend to blame others, offending others without realizing it. Due to their lack of empathy, they may not notice or care about how their words or actions hurt others. Feeling envious or assuming others are envious of them. They often feel superior to others, and if someone has greater achievements, they may become envious or even attempt to bring them down. Manipulation and control. They may use others to achieve their personal goals, regardless of how it affects others. The causes of NPD are not fully understood, but factors that may contribute include genetics. Some studies suggest a genetic predisposition to developing narcissistic personality traits. Childhood experiences and overindulgent, overly critical or unsupportive family environment may play a role in the development of this disorder. Emotional trauma. Experiences of neglect or emotional trauma during childhood can affect how an individual develops their sense of self-esteem. Treatment for NPD typically involves psychological therapy, such as cognitive behavioral therapy, CBT, which helps individuals recognize harmful thought and behavior patterns and replace them with healthier ways of interacting with others. Therapy can help individuals develop empathy and a more realistic view of themselves and others. However, because individuals with NPD often don't recognize that they have a problem, they may be reluctant to seek therapy or support, making the healing process more challenging. In some cases, treatment may take a long time and require a strong commitment to change. It's important to note that not everyone with narcissistic traits meets the criteria for narcissistic personality disorder. Many people may exhibit some narcissistic characteristics, but not to the extent that it significantly impacts their lives. Continuing the explanation of narcissistic personality disorder, NPD, here are some additional points that are important to understand. Impact on social and professional life. Individuals with NPD often struggle to build healthy social relationships. They tend to focus more on themselves than on the needs and feelings of others. This can create conflicts in personal relationships, such as friendships, family, or romantic relationships. In the workplace, they may find it hard to work in teams, feel dissatisfied with the recognition they receive, and may seek attention or power to gain admiration. This can lead to career problems, such as difficulty working cooperatively or gaining support from colleagues. Role of therapy in managing NPD. Psychological therapy is one of the main approaches in managing NPD. Cognitive behavioral therapy, CBT for example, can help individuals understand the thought patterns that lead to narcissistic behavior and replace them with healthier ones. Through CBT, individuals with NPD can learn a more realistic way to assess themselves in their relationships with others. In addition, psychodynamic therapy can help individuals explore and understand the root causes of the disorder, which are often linked to childhood experiences or issues in personal development. Therapists can work with the patient to build empathy and improve their ability to relate to others in healthier ways. While therapy can be very effective, as mentioned earlier, individuals with NPD often find it difficult to recognize that they have a problem and are resistant to treatment. Therefore, the success of therapy often depends on how open the individual is to change and acknowledgement that their behavior negatively impacts both themselves and others. Dealing with NPD in daily life. For people who have relationships with individuals with NPD, whether it's a partner, friend, family member, or coworker, it can be difficult to interact. Narcissistic traits may lead to feelings of being ignored, blamed, or manipulated. For those interacting with someone with NPD, it's crucial to set healthy boundaries, avoid getting caught in manipulative cycles, and protect their own mental health. Some steps that close individuals can take when dealing with NPD include limiting expectations. Avoid having unrealistic expectations that someone with NPD will change quickly or without a long process. Clear and firm communication. Express needs or feelings in a direct manner, without getting caught in unproductive arguments. Maintaining emotional boundaries. Avoid becoming trapped in harmful dynamics, such as trying to meet their needs without receiving appropriate recognition. Do all narcissists have NPD? Not everyone who shows narcissistic traits has narcissistic personality disorder. Narcissism exists on a spectrum, and most people may have mild narcissistic traits that do not harm their relationships with others. In this context, narcissism is more about having a high level of self-confidence or a desire for appreciation, but not to the point where it becomes destructive or isolates the individual from social connections. Healthy narcissism. This can be understood as a balanced sense of self-esteem, where a person feels comfortable with themselves without excessive narcissism. This occurs when a high sense of self-worth becomes exaggerated and involves an unrealistic need for praise and attention. Individuals with excessive narcissism may feel anxious or threatened if they don't receive the attention or recognition they expect. Prognosis and outlook. The prognosis for individuals with NPD can vary. Some people with NPD may live stable lives if they receive therapy and learn to be more empathetic and realistic in their views of themselves and others. However, for others, change can be slower and they may continue to struggle with interpersonal relationships and emotional challenges throughout their lives. Ultimately, a realistic approach to managing NPD is key. Therapy can be very helpful, but not everyone will succeed or be open to change. Furthermore, building an understanding of this disorder can be the first important step for both individuals with NPD and those involved in their lives. In summary, while narcissism, or narcissistic personality disorder, is a disorder that significantly impacts an individual's life, proper management through therapy can help individuals diagnosed with NPD lead a better life and improve their relationships with others. It's crucial to understand that NPD can have a long-lasting impact on individuals and their loved ones. But with the right help, recovery and improvement are possible. In some cases, individuals may not completely change their behavior, but therapy can help reduce the harmful effects of NPD on their lives and relationships. Ultimately, therapy aims to help individuals with NPD better manage their symptoms and enhance their ability to form healthy relationships with others. Recognizing the signs of NPD early can help both the individual and their loved ones take steps toward addressing the issue and seeking professional help. In many cases, those with NPD may not seek help on their own, as they often do not recognize their behavior as problematic. Support from friends, family, and loved ones can be essential in encouraging those with NPD to pursue therapy and work towards self-improvement. While the journey can be long, individuals with NPD can learn to manage their symptoms and improve their relationships through consistent therapy and self-awareness. In the end, fostering understanding and compassion for both those with NPD and those affected by it can be crucial for healing and building stronger, healthier relationships. In conclusion, understanding narcissistic personality disorder and its impact on individuals and their relationships is crucial. With proper therapy and support, individuals with NPD can learn to manage their symptoms and improve their interpersonal connections. It is important to approach this disorder with empathy, patience, and a commitment to helping those affected live a fulfilling and healthy life. By acknowledging the challenges and working toward change, recovery from NPD is possible, and relationships can be strengthened. Thank you for listening and learning more about narcissistic personality disorder.